Hello, everybody. Good afternoon to you all. I'm Ira Bagga, and I'm an intern at Sipher. Today, for World Oral Health Day, it is my pleasure to introduce our webinar on the connection between oral health and mental well-being. I'm very delighted to invite Dr. Rakesh Gupta, President and Director of the Strategic Institute for Public Health Education and Research, to start off the session today.
Yeah. So thank you, Ira. So Oral Health Day, every year we ask the world to unite to help reduce the burden of the oral diseases which affect individuals, health systems and economies everywhere. World Oral Health Day that aims to empower people with the knowledge, tools and confidence to secure good oral health. Oral diseases are a major health concern for many countries and negatively impact people throughout their lives. Oral diseases lead to pain and discomfort, social isolation, and loss of self confidence. And they are often linked to various serious health diseases. And yet, there is no reason to suffer more. Most of the oral health conditions are highly preventable and can be treated in their early stages. A happy mouth represents many aspects of well-being, and we began our journey by exploring the links between the oral health and the physical health. The focus this time spotlighting how a happy mouth that contributes to a happy mind. The campaign will address another vital topic, the connection between the oral health and mental well-being. In India, tobacco use, especially the smokeless forms like gutka and pan masala, mixed with tobacco, that is a major public health concern, significantly increasing the risk of oral diseases, including oral cancer, gum diseases, tooth decay, and other health problems. So we have with us Dr. Arpit Gupta, who is Associate Professor, Oral Health Science Center, PGIMER, Chandigarh. He'll be talking about the oral health use of SLT, that is smokeless tobacco and ends. Dr. Reena Kumar, we have with us. She's the Academic Director, Icon Care, Academic Director, Indian Academy of Sports Dentistry, Regional Clinical Advisor, Special Olympics, Asia Pacific. And she'll be talking about the theme that is a happy mouth is a happy mind. And then we will be listening to Dr. R.P. Gupta, who is pedodontist and dental surgeon and an executive committee member of the Indian Dental Association. He'll address us as a chief guest. After that, we'll have a question answer session. So, first of all, we'll have Dr. Arpit Gupta, who is head of the National Resource Center for Oral Health Care of Children and Elderly of PGIME at Chandigarh under the National Oral Health Program. He is member of the National Steering Group on Oral Health by Ministry of Health and Family Welfare, Government of India. He is a dental public health expert. Formerly, he has been trained into global tobacco control at the Johns Hopkins Bloomberg School of Public Health, US, with an international scholarship. So thank you. So Dr. Arpit, over to you, sir.
Thank you, Dr. Rakesh, for having given me this opportunity to connect with you all. And let me have a moment sharing my screen. If somebody can confirm.
Yeah, it is visible. It is visible.
The full screen is visible, sir?
Yeah, it is visible.
Okay, so I would be talking a bit about oral health and the use of smokeless tobacco and the electronic nicotine delivery system. It's not a denying fact, and we all are aware that smokeless tobacco and ends has an adverse effect on oral health, but we will just try to, have a recap of how, this affects our oral health. Tobacco, as we all know, is a major public health concern worldwide. And as far as India is concerned, smokeless tobacco is even bigger a problem as compared to smoking, And because we know a lot of our population is into smokeless tobacco, which includes gutka, snuff, kheni, betel quid, and maybe many forms of smokeless tobacco is found in our country. Whereas, we are facing a newer crisis in the names of ENDS or the electronic nicotine delivery system. Although the government of India has banned the electronic nicotine delivery system in all its forms, but still, it is being abused, especially by youth in certain parts of our country. So we will be talking about ends as well. And when we talk about ends, it is about e-cigarettes, it is about vapes, it is about heat not burn devices, and many more other, similar variants of ends. We all know, and I think this is something which is staggering, that nearly one fifth of the students aged 13 to 15 have used or tried tobacco in some form or the other in our country. So this number is really important to understand. One fifth to the age of 13 to 15. Just a very quick recap. No, tobacco contains nicotine, it contains cancer-causing nitrosamines and additional 4,000 chemicals, amongst which there are many chemicals which are known carcinogens. Some says it is 60, some says it is 300, but there are many, many chemicals which are known carcinogens. And when we talk about smokeless tobacco, and these are all Indian images which talks about tobacco in pan, the pan masala also containing tobacco, or tobacco added to it, the gutka, kheni, zarda. Even we have some dentifrices, like gul manjan and other things, some tobacco containing tooth powder, or maybe toothpaste as well. So even those are available in our country. And when we talk about ends, we talk about vapes. They come in various forms like vape pens, then e-cigarettes, e-pipes, and they largely contain a flavoring agent, propylene glycol, vegetable glycerine, and many other ingredients. And the liquid is heated to create an aerosol that is inhaled. BD, again, is more common in our country as compared to cigarette, only because of, its easy availability and economic reasons. And among the chewable form, the most common form is Kenny, which is being utilized. As far as e-cigarette is concerned, the government has already banned e-cigarettes in all its forms, but still, it's like quite recent. Only yesterday, I've taken the snapshot. There are many websites online specifically, where these e-cigarettes are available and they are being still delivered to the doorsteps. And you can see, this and many more are there. So these products are still existing, in our country. And this is one of the recent articles which says that e-cigarette is a continuing public health challenge in India despite a comprehensive ban. So, and it also says that those individuals with higher level of education are among those who are most likely to use these, what they call as vapes. So this is really important looking at the oral health effect, the main topic for the day, let's talk about smokeless tobacco first. We all know, smokeless tobacco is the main cause of oral cancer, oral squamous cell carcinoma. And not just cancer, there are OPMDs, the oral potentially malignant disorders, which includes leukoplakia, erythroplakia, and there is a whole long list of it, including, OSMF, oral submucous fibrosis, and many, many, many more potentially malignant disorders, which are kind of a precursors to the oral cancer, which are like kind of find in smokeless tobacco users. It leads to discoloration and staining of teeth. It leads to gingival recession, pedontal pocket formation, and obviously a lot amount of plaque and calculus accumulation as well. Talking about e-cigarettes, this is a kind of a summary, which talks about the oral health effects of e-cigarettes, whereby it is known to cause mouth irritation, specifically known to cause dryness, burning, irritation, bad taste, bad breath, pain, and discomfort. It causes a lot of throat irritation, so throat dryness, irritation, soreness, cough, tonsillitis, uveitis, and paratracheal edema, laryngitis. It leads to periodontal effects, like increased accumulation of plaque, deeper periodontal pockets or periodontal probing depths, increased bone loss, higher concentration of localized inflammatory markers, and a high volume of circular fluids. It also leads to certain oral lesions, specifically the black tongue, burns, nicotine stomatitis, hairy tongue, etc. Dental effects, very important as far as e-cigarettes are concerned. It can lead to cracked or broken tooth, toothache, tooth discoloration, caries, tooth sensitivity, tooth loss, increased karyogenic bacteria, decreased enamel hardness because specifically because of the flavoring agents in the e-cigarettes, and it disrupts the oral microbiome, and it might lead to increased incidence of oral candidiasis and oral herpes as well. It has a cytotoxic, genotoxic, and an oncogenic effect, which increases the risk of cancer. And there are various reports whereby because it's kind of a battery operated device. So there is an accidental injury. There are various reports where these devices have burst within the oral cavity of individuals. So there is a risk for explosion as well. Looking at these effects of ends in a bit of more detail, if we look at the content, no, it has glycerine and some flavoring agents. Now, this glycerine and flavoring agent, it promotes the adhesion of the bacteria and leads to quick accumulation of biofilm on the tooth surface, which increases the risk of cavities. The aerosol from ends, they encourage the growth of Streptococcus mutans, leading to enamel demineralization and caries. If we talk about tooth discoloration, ends, even though there is no tar in ends, but the flavoring chemicals like menthol leads to staining of teeth. And if an individual is having some composite resin restoration, it leads to more susceptibility to discoloration. The ends leads to more susceptibility of the discoloration, especially the margins of the components. Periodontal disease, these electronic nicotine delivery system, they increases the level of pathogenic bacteria like P. gingivalis, and it contributes to gum diseases. The user experiences high rates of gum bleeding, deeper probing depths, and a loss of clinical attachment. And the dual use of ends with traditional cigarettes, it increases the risk of periodontal diseases further. So, a very important thing to understand. And if we talk about individuals who are having oral implants, so these ends, they show higher plaque index, deeper probing depth around implants, indicating a risk for peri-implant diseases. And again, a long-term effect on implant stability remains inconclusive. Talking about oral mucosal damage, in ends leads to dry mouth, burning sensation, irritation, and it again further depends on the flavoring agents of the end. And some user experiences conditions like nicotine stomatitis, black tongue, and hairy tongue as well. And there is a potential risk for oral cancer. And aerosols, certain aerosols of ends are known to have nitrosamines and acrolein, which can contribute to oral cancer as well. And very importantly, it is heat based. So high temperature from these vaping devices can release harmful aldehydes, leading to oxidative stress and DNA damage. So this is a broad mechanism of how ends lead to DNA damage. So end leads to exposure of oral epithelial cells to harmful component from e-cigarette aerosols, and there is a decreased total antioxidant capacity. There is a persistent oxidative stress, and therefore there is inflammation, there is disruption of oral microbiome leading to some pathological changes, and the DNA repair mechanism is impaired, leading to accumulation of oxidative stress or maybe free radicals and reduced repair mechanism, and ultimately there is some amount of mutation which increases the risk of developing squamous cell carcinoma. Talking about studies, we have a hell lot of studies in the literature which talks about effects of these ends on oral tissues, on periodontitis, on the risk of developing oral cancer. All sort of studies are available, and I think you can very well find them over the web. Talking about our role as healthcare professionals, first and foremost, it starts with early detection of such lesions, and even before that, it is about patient education onto the risks and motivational intervention for sedation. So these are really important things to understand, and very importantly, promoting the healthier alternatives. Because many people do use it because of they have their own reasons of using it. So we need to counsel them about the risks involved. There has to be some motivational intervention for cessation and promoting healthier alternatives. Tobacco endgame, I would not like to talk much about it, but yes, this is the need for the hour, and there had been many initiatives on this. And Empower is an important strategy, which brings out a roadmap for tobacco endgame. And just very basic to understand is monitoring tobacco use and preventing pen prevention policies, protecting people from tobacco smoke, offering help to quit, warning about the dangers of tobacco, enforcing bans on tobacco advertisement, promotion and sponsorship, and raising of tobacco taxes. As healthcare professionals and oral healthcare professionals specifically, we need to strengthen activities related to behavioral counseling and support groups, nicotine replacement therapy and medications. And we need to support the government policies and the ban on ends. And yes, we need to be very active in supporting and initiating public awareness campaigns against smokeless tobacco ends and tobacco in all its forms. So, just to conclude, the smokeless tobacco and the electronic nicotine delivery system poses significant risk to oral health. There are ample amount of risk to overall health and significant risk to oral health as well. Prevention and cessation efforts are crucial, and therefore, dentists, policymakers, and all public health professionals play a very, very important role. I think that's it, what I have to share from you. Thank you so much, please.
So thank you, Dr. Arpit, for telling us, rather all the participants, about the various forms of SLT, and canny is the most common of them. And you also told about the ends, the e-cigarettes, the e-hookahs, the vapes, the heated tobacco products. And though it is banned, the electronic cigarettes are banned in India, and the gutka as well, it is banned. But still, these are available online and offline as well. So with the SLTs, you can have oral cancers, potentially malignant erythroplakia or leukoplakia. Then staining of teeth is there, plaque formation is there. So that is true. And people know very little about e-cigarettes because youngsters, they think that it is safer to use. But there is tooth decay with it. Tooth discoloration is a periodontal diseases are there, and there are effects on the bad effects on oral implants also. The risk of peri-implant diseases, oral mucosal damage is there, and there's potential of oral cancer as well. So that is important. And then you also told about the accidental injuries because of the explosion of the batteries. So that is also important. DNA damage is there, persistent oxidative stress is there, and there is a lot of role of healthcare professionals. They should motivate because Dr. Reena is the mostly into tobacco cessation. She knows it well that all healthcare professionals, they must motivate and promote tobacco cessation for all, including SLT and ANS. So you also told about the empowered package of the WHO. So thanks a lot. So now I think we will move on to Dr. Reena.
Thank you so much. Thank you.
So Dr. Reena, a very brief. So I'll talk about briefly about you. So Dr. Reena is MDS Orthodontics. She is Academic Director of Eye Care, and she's also Academic Director, Indian Academy of Sports, Dentistry, Regional Clinical Advisor, Special Olympics, Asia Pacific. So, and 40 years of academics and administration, former principal and dean of the Divya Jyoti College of Dental Sciences. She's professor and postgraduate.
Dr. Rakesh, I think it's
Okay,
okay. I think we
I
all know
just
each other in our groups. Thank you
okay.
so much. Thank you for
So
the
most
very
of
kind
the
introduction.
participants they can read the details,
Thank you.
and you can share your own
Thank you so much.
presentation. I'll stop sharing mine.
Yes, please.
Okay.
Thank you so much for the very kind words of introduction and very warm introduction. I really thank you and for this very warm invite to come and speak on a topic which is I'm very passionate about, very, very passionate about. So give me a few minutes. I'll just start sharing the slide.
This presentation, I'll request all to please open up their video so that we can have a snapshot.
Is my presentation visible?
Yeah, it is visible.
Thank you so much. So once again, I'd like to thank Sipher. I'd like to thank RCTC and of course, Echo Platform for giving us this opportunity. While I thank the opportunity to work, and Eye Care has been a great platform from which I have grown and in this tobacco cessation world. But today, I have been given the topic of World Oral Health Day. A happy mouth is a happy mind. I start my presentation by saying that how simplified my presentation has been made because of Dr. Arpit's presentation, where he's actually talked about so many issues, and so many important factors which actually overlay one into the other. So if we look at what is oral health really, so the core of the oral health would be just that each one of us should be able to do our regular functions, which would be eating, breathing, speaking, smiling. This is the essential functions of the mouth and the teeth, mastication, for which we have to be able to chew very well, which would also encompass the very next role, which would be if we have good teeth and if we are able to do all of that, there's a psychosocial dimension, which is self-confidence and social participation, which comes in. And of course, we all know that there's a life course variability. Our dentition changes from the very life in our entire span of life. And integration into general health, how important it is that it is actually the mirror of the body, and oral health is the mirror which systematically integrates into the general health. Very important because of our good oral health, that societal participation and the ability to engage in society as a very responsible member of the community is what comes right in. The global burden has, of course, been touched already in many ways by Dr. Arpit. So essentially, we'll put it down as it is the dental caries, the gum disease or the periodontal disease, the tooth loss, oral cancer, the trauma, which is there because the dental trauma is a very important part, a lot of ulcerative gingivitis and a lot of ulcerative nomas, which we call cleft lip and palate. And this impact is seen mostly in the low and middle class income groups. And population growth is one of the reasons. There is aging populations. But above all, I would say, what really is the problem is that the access to care, first of all, the information, the knowledge, the access to care, are we putting the preventive measures well in place, and how well are we on the public awareness path of this? Though Oral Health Day, World Oral Health Day. So before I begin, I'd just like to delve into a little bit about why did we start and when did we start? So this was on 12th of September 2007, World Oral Health Day was established. It was established basically as the birthday of celebrate the birthday of Major General George Gordon, who's the founder of the World Federation of of Dentistry. So the World Oral Health Day was later shifted to 20th of March because it was kind of conflicting with the conference timings. So it's a World Oral Health Day, we will say it's a public health celebration. It's a global healthcare event with an objective, which is to raise awareness about oral hygiene, its importance, and the factors that contribute to oral diseases. And I think Dr. Rakesh Gupta gave us a very well insight into it. So I will stop right here. But very important is to understand how the themes went on over a decade. It started from 2013. And you can see right there, it comes into healthy life. We're talking about smiles. We're talking about a smart mouth. We're talking about celebrating smiles. Going on to the body and the mouth. By 16, we are looking at healthy body, healthy mouth. And we say, mouth, think about health. And then we come into the 19, which is act on mouth. And now 20, 21, 22, which is, when we had the COVID period, where we said, unite for the mouth health. Be proud of your mouth, be proud of your mouth, and be proud of your mouth. And this was constantly being pampered and being pushed in by the World Oral Health team, saying that we really need to get very conscious. And by 2024, we said a happy mouth and a happy body, which comes in. And then comes 2025, where we have actually moved from the mouth-body connection to the mouth-mind connection, because happiness really is going to be only from there. So when we have to look at what does the World Health Organization say about mental health? So it promotes mental health as an integral part of the general health. It's a well-being. It's a state of well-being where an individual realizes his or her abilities, and we are able to cope with our normal stresses of life. Everybody has stresses, but we should be having the ability to cope with it. And many times when we can't, there is tobacco and there is various other things. So mental health gets affected, and we should be able to work productively and can make a contribution to our community. So that is what is mental health as defined and as suggested that by World Health Organization. So when did mental health in India, though overseas it has been a little different, people are quite open about talking about it in many societies, but in India, it's been something which has been kept behind the closed doors. It's a closet thing. But it is actually with the COVID that, when we had depression, anxiety, loneliness, and people were resorting to alcohol, tobacco, domestic violence, abuse, and all kinds of things, that we really started talking in our country about mental health. And mental health and oral health may be correlated with associations demonstrated between mental health problems and tooth decay, periodontal disease, and tooth loss. So Dr. Arpit has already talked about a few of these points. So now how he talked in terms of relation of how it works with, using these tobacco products. And I am going to take you in to see that how do this tooth loss, tooth decay, periodontal disease, and tooth loss is actually going to be having any effect on our mental well-being. So how does mental health and oral health get correlated? So we would say that the mental health common diseases, disorders, which would include depression, anxiety, bipolar disorder, schizophrenia, dementia, alcohol, and drug use disorders. So the interplay of oral health and mental disorders involves dysregulated microbiome. Today's day, the whole world, we are talking about whether it's the microbiome in the mouth, whether it's microbiome in the gut. So what is the connection which is there? So it's a dysregulation of the microbiome. There's a translocation of the bacteria. The bacteria which is supposed to be there in some place translocates. We talked of the biofilm. So how the biofilm does a transfer, what happens, and does this really cause a systemic inflammation? So this is where we are getting deeper into things and seeing that how the mental disorders, it still seems a little confusing at this minute. But now comes the thing that we need to understand, that we know that the brain is the central regulatory system. It is a regulation which manages the whole system of our very living being. But there's a craniostomatognaathic axis. So there's an axis, it's a complex communication which happens between the brain and the stomatognaathic system, which highlights the relationship between oral health, mastication, and brain function. So I really want us to kind of concentrate on a few things here, which I'm going to talk about mastication and oral health and oral diseases. So there is a bidirectional relationships. Brain and the stomatognaathic system are interconnected and influence each other. So how does that happen? Let's get into it to see it. So there are lots of articles which tells us that this neuronal network which is there, it's a complex pathway involved in mastication. The mastication is the process by which we are chewing our food, which you can do it well only when you have teeth, when you do not have pain in the mouth, when you do not have decay in the mouth, when your gums are not swollen, and when you are able to eat and appreciate your food is when you're going to be able to chew. To make this process happening, there's a huge neuronal network, and this causes a sensory feedback, which provides information to the brain. And how does this really happen that it works on the cognitive impact? So it influences that. So let's go into it and let's look at it. So what really happens is how mastication would increase the blood flow. It's primarily in the sensoromotor cortex and the cerebrum that it gets the blood flow is increased, and it activates the widespread brain regions, which influences cognitive function. So 1 and 3 are very closely, interrelated. Now, motor learning. So we need to be able to, that's body's adaptation, So whenever we are The brain has to learn to make us adapt to a certain circumstance, whether it's a skilled movement, whether it's a voluntary movement which we are making every time, a routine movement. And how is that this connection is obtained between the brain and the spinal cord, which makes sure that we are able to get a spatial relationship. So the motor learning is also initiated by, because this is a voluntary movement which we are doing all the time. It's a repeated movement, a chewing. And then we need to understand what is it that is the hippocampal function, because the hippocampal function is what makes us into being there today. So being there today is that how do we have our memories? Do we have the new memories? Are we able to make declarations of the memories? So we say, call it a declarative memories. Do you have the new declarative memories? Does that person have episodic memories? So it helps you in various types of memories, recalling some episodes, semantics, so words, able to understand words, short-term and long-term memory. So the hippocampal has memory as a major function. Navigation, so it can tell you where you are just now. The person is able to also understand the environment and also remember routes. So remembering the way back home, remembering the way to office, or remembering the way to the bathroom, and various things like that. Learning. So flexible cognition happens, and emotional processing. All of this comes here, and social cognition. So you see the simple factor of mastication. So when we are masticating or chewing our food, and we always say, take time, to masticate, to feel the food, to enjoy the food, but we are also activating the brain. And this brain is through these three processes, and which is actually looking into our cognitive abilities and the hippocampal function, which is a very important part. So this is a little picture which kind of tells us that the greatest brain, the areas of the activated during mastication were the frontotemporal cortex, the caudate nucleus, and the thalamus. This was a study done basically to partially edentulous patients, for the non-dental people who are here. This is for the people who do not have all the components of the dental structures in their mouth. So they would give them a plate, and then they saw how they kind of increase. So the increase in cerebral blood flow resulted in increased neuronal metabolism in the region linked to learning and memory. In addition, when they took off this, they found that the edentulous participants, the participants who do not have teeth in their mouth, had a marked prefrontal deactivation when they chewed without a prosthesis and presented a decrease in the masticatory activity. So the role of mastication and the stomatognathing axis, the craniostomatognathing axis, and what it does in the longer role, and how it plays a role in actually, a mind that we are right there. So how is it that? Periodontal disease. It's one of the diseases which is, I think, most prevalent. Oral microbiota plays a role in maintaining the overall health, and its dysbiosis. So we know that what happens influences chronic inflammation and the pathogenesis of gum diseases. So whenever there is a gum disease, there is inflammation. We talked about it in the previous presenter, spoke about it, saying how there is a cytokine storm in the body, and there is so much happening. Besides that, now because we are talking mind, I will also bring in the psychosocial impact of it, where we say that there is halitosis, there's bad breath because there's gum disease in the mouth, and there is rotting food and there's rotting things in the mouth. So halitosis, and this, when the minute you have the gum disease, that the periodontal disease, you're losing bone. And bone is what is actually supporting the teeth. And when the bone starts getting lost, the gums are receding, the bone is going, and the tooth is going to get lost. So there's going to be changes in appearance. We are going to lose our vertical height. We are going to keep losing. We're going to look older. We're going to look wrinkled. Difficulty in chewing and eating obvious, and of course the chronic pain. So we need to understand how, there's a cycle of depression and oral health. So when you look at it, it could be anywhere that you start. You could start with just the fact that there is poor oral health. So immediately you can, it exacerbates the depression syndromes, that the person starts feeling really bad, like, oh my God, I don't feel good. I've got pain. I can't eat. I can't do this. And, my mouth is smelling and I don't feel like socializing. And then comes a lack of motivation. Depression leads to reduced motivation for daily tasks. Of course, infrequent brushing, because the brushing, this is the hygiene factors of oral hygiene, that is simple act of toothbrushing, which actually looks after a major part of our oral health, is reduced. And this is how periodontal disease, mental health, it's like a vicious cycle. We call it the cycle of depression and oral health. That's what it's called. Now, periodontal disease, there are lots and lots of articles. There are articles in the psychiatric journal and there are articles in the Frontier. So one of the articles I've referred here is the Frontiers. It is from the Nature Science, which says that chronic inflammation, systemic effect, and mental health. So how does it really go? So it works that it's a bidirectional again, but the relationship is both with psychiatric illness as well as substance use disorders. So we have talking of tobacco also comes in right here. So periodontal disease contributes to the development of exacerbation of the psychiatric illness and the substance use through the systemic and chronic inflammation which happens. And the strongest association is actually with the substance use disorders. So there is that, but the periodontal disease and substance use disorders, which has a very strong, and this has a very strong exacerbation of the mental health. So it is definitely going to affect and depression and anxiety and all of that. While we are talking of this, of course, there are huge other numbers of effects which can have multiple interactions, and periodontal disease inflammation is just one part of it. But then you see there are other drugs and other things which a person with mental disorders or with some depression is given, which may cause xerostomia, dryness, causing other issues inside the mouth. So this is an interesting study. The study was done basically to understand, what is the quality of oral health of life and what was the patient health related quality of life. So that was. So they found that the people, so they found out the socioeconomic positions, they put it there. And the important factor, they said that when was your last dental visit? Do you plan a visit? And have you been seeking dental treatment? So they found that the people who actually sought dental treatment, if you sought dental treatment, you had a better oral health quality of life. And then the PSQ-9, which is, about the patient health quality of life and which really decides whether you have got a depression and you are able to rate yourself, it is much better. You are working. So there's a very, very nice study. This was done to understand what is the relationship of oral health. Simple act of wanting to see a dentist, to be able to go and see a dentist, or to understand there's a problem in your mouth and to be able to seek, and to do brushing, oral health behaviors, which are there, which we say is a very important factor. Oral disease and mental health. So dementia has been associated with chronic periodontal disease. And periodontal disease conditions provide a peripheral source for pro-inflammatory cytokines and a final consequence of tooth loss, because with these cytokines, you're going to keep on having bone loss. You're going to have osteoclastic activity and the bone is going to get resorbed out and you're going to have the loosening of the teeth and eventually the loss of teeth, which, starts another cycle of looking different, eating different, not being able to eat, and all of that. So lots and lots of studies. So you have the Psychiatric Association, American Psychiatric Association, of course, you have the CDC, and you have Journal of Dental Research. And it all says very clearly the dysregulated microbiome, translocated bacteria, and the systemic inflammation which comes about. And there's a greater risk for dental decay and tooth loss, which can lead to more frequent pain experience, social isolation, and low self-esteem, thus reducing the quality of life and in turn possibly being associated with poorer mental and overall health. When you don't feel good and you don't feel like going out, you don't feel like meeting friends, you don't feel like going to work, it all starts over there. So I would like to come to the last few slides where, I really want to see where are we currently today. Where India is concerned and where our population is concerned, the mental health services are included in the Ayushman Bharat through the Ayushman Bharat Pradhan Mantri Jan Yojana, Arogya Yojana, and also through the Ayushman Bharat Health and Wellness Center schemes. Now, this schemes, what do they provide? They provide access to mental health care, including treatment for mental disorders at both primary and secondary, tertiary levels. So you see, mental health has been very well accepted by our government, and they are also taking the steps to include it in the public health forums where we are able to, any citizen is able to get it. But where are we on the world on the oral health? Is it something which we are going to do only on world oral health, conduct a few screenings here and a few screenings there, a few talks here and a few talks there? And what is going to happen? Because currently oral health services are not explicitly covered under the Ayushman Bharat or any one of the schemes which is there. We have very limited government support and we have a lack of insurance coverage. So how is a person going to seek dental treatment if he does not have the means to get it within his earning capacity? If he has to pay out of pocket, or if he doesn't know where to go, or if he has to go to high-end clinics, or if we do not have places where they are going to have access to care, oral health care, as a very bare necessity. So I do not know this World Oral Health Day 2025. We definitely have now is the time for action. We really need to have the time for action, because if we are looking at mental health and happy mouth and a happy mind, and if the mind is being actually attended by our government, and we are understanding it, and our people have that, but then if the mouth is contributing a large amount to that happiness quotient, so we really need to know what is happening in here and what should we be doing. We understand that there is a global strategy that the WHO has put out, that by 2023 to 2030 we have to have certain overreaching global targets which we have to meet, and by 80% of the global population is entitled to essential oral health care services. My dear friends, I want you to pay attention to the words which says oral health care services, not just screening. Services should be available to them. And of course, that by 2030, we should have a global prevalence of the main oral diseases, which we just marked out. Both the speakers have marked them out. And conditions over the course shows a reduction by at least 10%. We should be able to cut this down. If this has to happen, I believe we need, as dental surgeons, oral health providers and mental health care professionals, health professionals, we need to collaborate. Because if we are not, as dental surgeons, looking into the patient's psyche as to how is he comfortable, or we just looking into his mouth and not looking at the human being, or how he is psychosocially placed at that minute, or if the mental health care professional is not looking into the mouth, or we are not talking to each other, I think somewhere now the happy mouth, happy mind will only stay on paper as one more theme that we have done. So if we need to really put this theme into action, we need various areas we have to work on. And this is an interesting poster, interesting billboard of a dental clinic. So whether we ourselves as dental clinics need to start putting boards like this, which is now telling our patients, your mental health is really connected to your oral health. And we need to start looking at, if a happy mouth is to be a happy mind, we need to, this is from McKinsey, I think it's really nice. We need to prioritize brain health. Yes, we need to prioritize brain health, obviously. So we have to scale what works to add years to life and life to years. So what is it which is going to scale? What should we scale to work to add years to life? So I would say, and life to years would obviously be oral health behaviors and accessibility of care. Two main things. We need to be able to talk to our population. They should be able to understand the importance of that simple 2-minute act of brushing twice a day, the simple thing of masticating, enjoying your food, going to the seeking dental care, and how will they seek if we do not create accessibility of care? So oral health quality of life and mental health quality of life is affected by several oral health behaviors, and many behaviors which include smoking, tobacco use, alcohol use, oral hygiene, especially toothbrushing, and seeking dental care. So ladies and gentlemen, with this, I will come to the end of my presentation. And I would say that it is time that we need to collaborate, convince each other, communicate, and actually work together for the larger interest if we really want this tagline of 2025, happy mouth, happy mind, to be, effective and not just on paper. Thank you, Dr. Rakesh. Thank you so much.
Thank you, Dr. Reena. Actually, we never think about this thing that oral health is so important for your mental well-being also. It is not, I don't think it is thought about by dental practitioners. But you have very presented it very nicely, that how the mental health that suffers because of the oral diseases. And you told us about the global burden of the oral diseases. And then you told us why this World Oral Health Day is celebrated. So it is because of the Major General Charles George Gordon, who was founder of the FDI, that this day is celebrated. So that is very nice of you to tell us, because we never actually knew about it. Then you told about the evolution of the World Oral Health Day themes also. So they have evolved because the mental health is in focus since the era of the COVID. It is more in focus, and A happy mouth is a happy mind. From the mouth body connection to the mouth mind connection. That is very important. And it has been prioritized by WHO as well. And you told us that mental health and oral health may be correlated with associations demonstrated between mental health problems and tooth decay. So thanks a lot, Dr. Reena, for letting us know why this correlation is important. So thanks a lot. So before asking Dr. R.P. Gupta to just give us his address, we'll just request all to please open up their videos so that we can have a good snapshot. So please open up your videos. Ida, you can also open. Show your faces, nice faces, please.
We'd like to see Ira. She has a lovely voice. So let's see.
Yeah. She's from Arizona, actually.
Oh, nice.
She's working with us online, basically as an intern.
Nice to see some very known faces.
Yeah,
Hello,
yeah.
Siddhi.
So Dr. Siddhi is also here.
Yes, very known faces. It's very good to see.
Yeah. So many people have preferred not to show up their face. It doesn't matter, but we have a good number of people who have shown up their faces. So over to Dr. R.P. Gupta for his address as a chief guest. Yeah. So Dr. R.P. Gupta, he's a pedodontist and a dental surgeon, and he's in the executive committee member of Indian Dental Association. And he did his MDS from PGI Chandigarh, has been serving residents of Chandigarh and surrounding areas since last 30 years. And he has a very nice clinic in Sector 8 in Chandigarh. His experience speaks of his expertise in the field. He also served as a dental surgeon in he also served as a dental surgeon in Sector 16. So it's a government multi-specialty hospital. He served there for 10 years. He is member of the American Academy of Dental Association and also member of the International College of Dentists. He is associated with many professional organizations and is an executive committee member, as I told you, of the IDA. He also has been honored with fellowship of PFA, that is PRA, Fortune Academy, as well as ICD. He is a life member of Indian Society of Pediatric Dentistry. So over to you, sir. Dr. Gupta, are you with us, sir? Dr. R.P. Gupta?
Sir, you have to.
Yeah. I think we have lost, he has lost connection, maybe.
Sir, he is there, but I think he's muted.
Muted, yes.
Dr. R.P. Gupta, you're muted, please. Yeah, I could try to do it from my end.
Now I'm audible?
Yeah, you are audible, sir.
Okay.
Yeah.
Now I want to express my gratitude to Dr. Rakesh. He is a past Director of Health Services, past Director of Health Services, Punjab government, and running a very important NGO with the name Sipher. And
Dr. Gupta, you can center yourself, please.
Yeah.
You're not in the center. Yeah. More. Yeah. Now it's okay. Yeah. Thank you.
And really, to all of you, it's a good day to me because I'm meeting this Dr. Reena after a long time, and Arpit is well known to me because yesterday we also met on the toxicity of the mercury in the use of the dental amalgam. Anyway, it is an honor and a privilege to join you today on this World Oral Health Day, and the topic chosen is about the No Tobacco Day. And the slogan given is the healthy mouth leads to a healthy mind. Healthy mouth leads to healthy mind. that is very, very important to us, all of the oral health workers. We have heard about Dr. Arpit also very nicely has explained in the detail what are the effects and how we can think of reducing it. Dr. Reena is also well known to me. We were meeting in the ICT meeting. I remained a past president of the International College of Dentists around 4 years back, and she used to come as a speaker in most of our meetings. Now, really, on this occasion, I theme which has been given is really very, very important to us. Tobacco in any form is a silent destroyer of the both oral and mental health. Stains our teeth, damage our gums, and increase the risk of the deadly disease. But beyond these physical harms, it creates an addiction and affects the brain function, leading to stress, irritability, dependency, and quitting the tobacco is not just a step toward a healthier body but also toward a calmer and sharper mind. On this World No Tobacco Day, World Oral Health Day, let us take place and safeguard our oral and mental health. Let us educate, inspire, and support one another to quit tobacco and embrace lifestyle that ensures healthy mouth and healthy mind. Here I will like to tell you also that Dr. Arpit is doing a wonderful job. He has now started in the world supervised brushing, toothbrushing. Toothbrushing is the most important for the oral health cavity. And he has started the project in the district Panchkula itself, and he has already covered most of the part of Chandigarh. I am very, very happy that our government, central government, is now looking after the oral health in a better way, and I wish that there should be more importance. As Dr. Reena also explained, we need a separate funding also for the oral health care for the Department of Dentistry in the state as well as in the other places. Once we get separate funding, then we can work much better and utilize the funds ourselves. Thank you so much.
Thank you, Dr. R.P. Gupta, for your wonderful, the words of advice. And you told about the importance of the theme of the World Oral Health Day. And you also talked about the wonderful presentations made by Dr. Arpit Gupta and Dr. Reena and what wonderful work they are doing actually. So I'm also very closely associated with them. So I know that they are working so hard in the fields. And I visited your clinic as well, and then came to know about your popularity also. So thanks a lot. So the forum is open for any questions by the participants. Dr. Siddhi, will you like to just say a few words about the World Oral Health Day? Dr. Siddhi, are you available? Are you with us? So, Ira, are there any questions in the chat box?
Yes, sir.
Yeah, Dr. Siddhi. Yeah, Dr. Siddhi. Your
Yes,
remarks,
sir.
please. Your concluding remarks, rather.
Sir, I, being a public health dentist, have been a close associate with Oral Health Day. And yes, as the theme has improved over the time, earlier we used to see that health was not given importance a lot. Then oral health came into line, and then mental health, and this thing took over. And yeah, it is a total makeover for body and brain. So we always say कि a good oral hygiene is must for all kind of health issues in the body. So this has definitely taken up awareness nowadays, and it should be taken up more likely by the medical. Thank you.
Dr. Siddhi, please introduce yourself actually. Where are you working now?
Sir, I have recently joined in Jamnagar Government College.
Oh, that's nice.
And I am a public health dentist. As an associate professor, I have been working here. I am a specialized tobacco sedation specialist too, closely working Dr. Reena has been my mentor.
Yeah, both of us
It's
are students
quite
of
good
Dr.
to
Reena
listen.
actually,
Yes,
as
yes,
yeah, as tobacco cessation specialist.
yes, sir.
Yeah. So, Ira,
So tell,
do we have any more questions?
Sir, before
I
we
don't
take the
think
questions,
so.
can I take a moment? Yeah.
Sure.
Yes, sir. So I just want to be a bit more appreciative about the efforts which government has made in the last probably couple of years in
Mhm.
terms of oral health, because we all should be knowing about those efforts. Only then probably we would be understanding, in which direction we are
Yeah.
heading up to. So
Mhm.
first and foremost, sir, I would like to say that with the launch of the Ayushman Bharat scheme by the government, which has got two main components. One is a health insurance, whereby an insurance of up to 5 lakh, and now they are making up to 10 lakh is kind of being given to households. And there is another component of Ayushman Bharat scheme, which is comprehensive primary health care. Now, the beauty of this comprehensive primary health care is that Ayushman Arogya Mandir are being established, and they are almost there across the country now. And these Ayushman Arogya Mandirs, they largely consist of a newly introduced workforce, that is a trained nurse, whom we know as CHO, the Community Health Officer. So the government is looking up to, bringing oral health into the mainstream of healthcare delivery system. I mean, oral health is no separate. It should be into the mainstream of healthcare delivery system, whereby into the extended packages of these CHOs, one of the package is oral health. Even mental health is one of the packages. So
Yes.
oral healthcare delivery at the grassroots level, we did talk about making oral health accessible. So that oral healthcare delivery, the basic oral healthcare delivery, basic services like pain relief, asepsis, and referrals. So these very basic kind of things are kind of being delivered through these CHOs right at the doorsteps, right, at these Ayushman Arogya Mandirs. So that's the whole idea. That's the whole concept. How government is trying to make oral health more accessible. Not just that, we know that health is a state subject, but under the National Oral Health Program, government is trying of pushing the state governments in making oral health care accessible by the means of establishing dental clinics up to the level of PHCs. Initially, if we talk about the IPHS standards of the country, IPHS is Indian Public Health Standards.
Mhm.
In Indian public health standards, the dentists were somewhere available only at the district level. Below that, it was kind of almost not as per the recommendation. But now, quite recently, the IPHS standards have been revised, and even at PHC level, having a dentist is being made desirable. And there are many states in our country, like let's say Haryana and a few more, which are having dentists at every PHC. So that's again a very important thing to understand. Yeah, one thing which we are kind of lacking, or maybe we need to improvise upon, is creating an insurance kind of a scheme for oral health care, which has no country in this world, including US, which is kind of one of the most developed ones, which is providing a free oral health care accessible to all its citizens. So there is no country in this world, but still, in our country, we are still able to provide the trauma services, the services related to oral cancer, and some impacted teeth, cysts, other services which requires hospitalization or some kind of a surgical intervention is already a part of the Ayushman Bharat insurance component. And yes, I think there are deliberations going on, and there are serious talks going on developing some mechanisms of including the outpatient services, some basic ones, like let's say RCTs and others in this component. And again, there are many states in our country which are providing free of cost denture services, extraction services, denture services, and many more to the people in our country. So what I am trying to say is, yes, we have a long mile to go, but yes, the government is kind of sensitized to the concern of improving the accessibility of oral health care to our fellow countrymen. And yes, positive steps are being initiated in this direction. Yeah, thank you.
Thank you, Dr. Arpit, for bringing this in. But however, I really feel that we have so many miles to achieve, and the preventive care is just not there. And the simple act of chewing, because if we don't lose the teeth, if they have the periodontal care can be given, there are so many states where periodontal care is not really taken care of. So my concern was more of because DK, everybody is talking about sugar, we are reducing, fluorides we are putting in. We have done all that. We have touched those milestones. It's very good. But I think periodontal disease is a very big issue.
So one important thing which I just missed, Abhi speaking about is under the leadership of some top officials, including directions from Niti Aayog, there are discussions, not just discussions, there are plans, and the pilot has already been initiated to implement school toothbrushing. Again, if
school is
periodontal disease. Toothbrushing is the key. Oral hygiene is the key. Awareness is the key. So oral health education and school toothbrushing be introduced just like a midday meal scheme of the country. In the country, every government school, there is a midday meal scheme. So under the pilot of this, under the leadership of ICMR, this project has been initiated whereby in 8 districts of our country, we are kind of testing and developing a model of school toothbrushing, daily supervised school toothbrushing in the schools, which includes government and private schools as well. And you believe it or not, we are right now working on daily toothbrushing of almost 6 to 7 lakh primary school children in our country. And next month onwards, we are going to roll it out. So what I'm trying to say is that, yes, we are a very big country, and yes, we have big challenges, but yes, we have made certain positive steps, and with all efforts of like-minded professionals, as we can see so many people out in the audience today as well, I think we can go a long way. Yeah, thank you.
Of course, it's all of us to get together, but I think we need to kind of move together with the medical profession hand in hand, because till we are actually, they understand the concept of oral health. Everywhere we find a blockage, whether I go into sports dentistry or whether I go anywhere, tobacco. You see, the concept of oral health and the importance of it in the entire well-being of the human being is not really been positioned in that clog of wheel yet properly in the medical group. So I think that's where we are lacking very much. And
for this, I would like to thank WHO.
Yes.
Last 3 years, there had been resolutions and back.
Yes.
So many things have come up.
So many things have come. Yes.
And the last slogan which they have given is no health without oral health.
Oral health, yes.
I think that's something, things are moving. We are in the right direction. Probably, yes, a few years down the line, we would be rather more comfortable. Yeah.
We are on the road. So that's the good part of it. We are on the road. The very fact that, this theme has come in, and once mental health is such a big issue now in the globe and in our country, and then oral health will automatically find its, as you say, it's already on the move. So many things are happening. I'm sure it's a very positive and very, there is light at the end of the tunnel, and a good bright light.
Yeah, thank you, Dr. Reena. So you have concluded it very well. Actually, I may share with you that I was working in community health center. So it is near Chandigarh. And we had a dental surgeon with us way back in 2015, I think. In 2010 we had. And even before that, actually. So in Punjab, actually, community health centers, they already, there's a post of dental
Chandigarh is exemplary, sir. So Chandigarh, because it's kind of urban.
I'm not talking about Chandigarh. I'm talking about periphery in Punjab.
Some states are excellent. Some states are doing very well. Like Haryana, just mentioned. Yes, Haryana.
Haryana is
excellent.
And I may add also that I am an external assessor for the NQRs. So under the Saksham, there's a Saksham portal for the online, checking out the sub-centers. So I found the CHOs, the community health officers, they are very, very well informed actually. And they know about the oral diseases also, some of the oral diseases also. and they provide the first, the first line of treatment, at least the first aid they always provide. So it is really good. So now I think we can have, if there are any questions, you can please ask. You can unmute yourself, or we can just ask
Can
Dr.
I add a comment?
Sure.
See, this presentation for which you gave me the topic, and because I've seen Arpit was speaking on the tobacco part of it, so I did not even touch that at all. But what I want to say is I learned so much. I really have to thank you. I don't know how many dental surgeons or how many of us knew, the role of the how the craniostomatognathic axis and what it does and how mastication and the increase in the blood flow. I didn't know it, frankly, myself, that part of it as to how much cognitive effect of it. So I think we ourselves have so much to learn about it, and to talk about, because we are always caught up, yes, with a lot of decay and cancer and all of that, because in children we are concerned. So thank you for giving me this presentation, because
I must admit that we learned a lot
quotient,
new things from you.
My learning quotient
And
increased a lot.
it was an excellent presentation. Yeah.
Thank you so much for giving me the talk.
So, Dr. Arpit Gupta, may we have concluding remarks from your side, please?
Really, today it has been an excellent session. So many things we came to know, that the oral health has been given so much importance that it is related to the mental health.
Yeah.
And mental health is now the most important. You will be surprised to know the figure. Out of 4 or 5 persons are suffering out of the 10 persons mental health.
Yeah.
So the importance to oral health, to our profession. Thank you so much. You are a medical man, of course, a public health man. But you have given a lot.
So I'm basically ophthalmologist, but not public.
Ophthalmologist, good.
Yeah.
Really, it will help us.
Yeah,
Like
sure.
person like you in medical man, when they hold such type of the show, it's a great favor to our oral health workers.
So thanks a lot, Dr. Gupta. Thanks a lot. And over to Ira for a formal vote of thanks, please. Ira, can you show your face? Dr. Rina wants to see you actually.
I just want to thank her.
Ira?
Nice.
Are you with us?
Yeah, can you see me?
Yeah, we can see you. Yeah. Thank you.
Good evening, Ira.
Good evening. How are you?
So you want to know the names of the people who you have to thank? I'll just share the names of the people. Oh. So Ira, so these are the names. Ira, are you with us? Okay, then if Ira is not with us, I can propose a vote of thanks for Dr. Arpit Gupta, Dr. Reena Kumar, Dr. Arpit Gupta, who is our chief guest, and all the participants who have participated, especially Dr. Siddhi, who is known to us, and she's always with us in the webinars. So thanks a lot to all of you, and I'll be sharing the link to the YouTube channel also. So we'll share the YouTube link for this recording so that you can see it in detail. Especially, actually, Dr. Reena's presentation was different. Dr. Arpit was he basically presented the oral diseases, maybe known to some of the dentists. But Dr. Reena, I think she actually found many new things for us. So thank you, Dr. Arpit, Dr. Reena, and Dr. Arpit. So, thank you, Ira,
Thank you
for being present.
Thank
here.
you. Thank you.
Thank you very much.
Thank you so much. See you after a long time.
Thank you. Okay, bye.